Hello, and welcome to another episode of Cutting Edge Health. Today, we're talking about white blood cells and platelets and how they can help many times better than surgery. If we haven't met, I'm Dr. Orlando Landrum, a physician that helps patients understand their options for either being able to improve mental health, physical health, and how to be able to help heal brain and body so you can live longer and have a better life. Today, we're talking about back pain, and we're talking about back pain exclusively, predominantly because although you might live for an extended period of time, if you can't do the things that you want to do, really, are you getting the value that you really like to be able to lead the life that you deserve? So today, we're going to get into some techniques that are new, that are different, unique, and we're also going to be able to commemorate an individual who was instrumental in terms of being able to change the way we look at how we can be able to do treatments. So when we look at this, one of the things we want to be able to kind of have an understanding of, is there a way to be able to avoid surgery? And yes, there is. So stay tuned and let's talk about it. Talk about back pain, we can know that there's a number of different types of discs that are out there, where you have a normal disc, as you can see from the top, going down to a degenerative disc, which is basically a decreased height. A bulging disc that we frequently heard about are herniated discs, which are very similar in nature, which it comes back and pushes against nerve roots and sometimes can have radicular symptoms similar to something that's called sciatica, where you have pain that goes down the legs or in the neck, can go down into the arms. A thinning disc, which is similar to degenerative disc, where you have also a decrease in height of the disc, and various different components of osteophyte formation or calcium formation that's in place. We talk about how frequently is this likely to come up and how it might be impactful. One of the things we can see is that as we're younger and we increase in age, we can see this increased likelihood of having degenerative disc disease that propagates particularly within the ages of 50 to 60 and 60 to 70. So one of the premier individuals who looked at how can you be able to treat disc issues is the name Greg Lutz. For those of you who haven't heard of this gentleman, he's actually had an impact even on myself. He was a physician, and this is Dr. Gregory Lutz, who passed in March of 2024. And he was one of those individuals who was unique. He founded the Hospital for Special Surgery's Regenerative Medicine Pain Fellowship that was in association with Cornell University, and became one of the largest outpatient musculoskeletal practices in the nation. In addition to that, he revolutionized regenerative medicine, was frequently present at many of the talks that teach doctors how to be better, and eventually opened up the Sports Care Institute, the Regenerative Sports Care Institute, which was a state-of-the-art center for regenerative orthopedic medicine in Manhattan's Upper East Side. So what was unique about what Dr. Lutz did? Well, what he did that was different is he looked at using PRP, and for those of you who followed our channel, platelet-rich plasma, but at high doses to be able to get a response. And so what does that mean? In essence, one of the papers and various different analogous components that he had in place was looking at intradiscal leukocyte-rich plasma. So what does that really mean? So what that really means is by taking PRP, or the platelets, and isolating specifically for the ability to be able to get white blood cells at a high concentration, it was shown to have a number of different benefits. So when you look at those disc issues, we can see that you can have a normal disc as shown in the top left hand, and then you can see these other different types of issues that can occur, whether you have a bulge or a herniation, an actual rent or tear in the disc, or a sequestration where you have a pop off of the disc that's in place. Many times we think that, oh, you have to open up the back, or I have to have this major surgery, or I have to have a fusion in order to be able to get better. And that's not what Dr. Lutz did. What he said was like, why can't we use our body's natural healing factors to be able to heal ourselves? So one of the things he looked at was to be able to use those high concentration platelets and white blood cells, which is the thing that's different, the leukocyte rich, and be able to deposit it. So on the left-hand side, you can see an MRI image that shows a picture of a disc that has that degenerative disc that's in place, modic changes, which are changes that are present within the aspect of the bone. And then you can then see an injection after they received a leukocyte rich PRP treatment at L4 and L5, the two lowest levels, which are denoted by the arrows. You can see a height change, you can see less compression, and it was not something that was just a one time. He presented on this multiple different times to be able to show that this is not a traditional phenomenon, and it can be repeated and repeated with consistency. So there are a number of different papers where he was able to demonstrate these changes that took place that were just phenomenal. And from where the disc looked narrow and small and bulging and herniating, and stopping that herniation, and we're able to have disc height restoration. So, and given a summary of one of his papers, one of the things that he stated was the following, is that they were able to take a look and not just do simple PRP, which is a different, right? Where you're looking at that aspect of less than 10x or 10 times the concentration, but to be able to use higher concentrations that gave relief that was sustainable and significant. So many patients that are and individuals who watch this channel will then say, so how does that apply to us? Well, we've taken some of those things that Dr. Lutz has done and said, how can we be able to make this different and unique? And as a clinic, one of the things that separates us from probably one of the few clinics in all of the entire country is that we take a combination of regenerative medicine or orthobiologic principles, and we combine it with minimally invasive procedures, so it's not traditional surgery, not having to be open. So our clinic is Cutting Edge Health, as you very well know, located in Indiana. And one of the things that we did is said, how can we minimally invasively do this and do this in a safe way? And one of the tools and techniques that has come to the forefront is the utilization of hydrocision or spine jet. Previously, this was a technique that had to stay within the aspect of the disc alone, and it allowed for you to be able to just take out a portion of the disc, assuming that you felt like that was necessary. But what has come about is that now there's a way to be able to do this under direct visualization. So you can see if you needed to remove areas that were causing a compression, then you can do so. So how does it work? It does it by, instead of having a mechanical component, by using water, and that water is able to resect areas in a safe way so you don't damage tissues. So how is this done? Basically, there's a handset that looks like this, and now we're able to do it underneath a scope that allows for us to be able to use this area to get to the region. So how do we apply this in combination with regenerative medicine? In essence, we're able to then previously have isolated for a high dose PRP using the aspect of leukocyte-rich preparation, and use that to be able to help heal the disc at the same time dealing with mechanical obstruction. So we're getting a 2-for-1. So you can give a better outcome, get you back on your feet, help you punch pain in the face, and lead the long life that you deserve. If you found this video helpful, hit a thumbs up for us. If there are things like this that you'd like to learn more about in terms of how we help you, teach you, give you your options for learning how to be able to lead a longer, fuller life that really is something that allows for you to do the things that you want to be able to do, hit the subscribe button. Thank you so much for your time and attention, and have a great day.